Okay, so we know from our work on tensegrity that the spine is a free-floating structure within the soft tissue. So an important part of shiatsu work is mobilisation of the spine and decompression of the spine, that is to say stretching it out to allow the vertebrae to float within the tensegrity system. And we can do that by going deeper into the spinal structure and actually allowing ourselves to experience how much movement there is in the spine, and I'll demonstrate that. So rather than just palpating from the outside like this, which is the kind of traditional way that we can do it, we can be much more dynamic with that by opening up the back and then actually providing enough movement to actually feel how the spine and how the individual vertebrae are moving. Now we do that within the context of our diagnosis and our vibrational assessment of the spine. So it would be very individual depending on the client. We may be removing obstruction, we may be tonifying and supporting the energy. It may be very specific on one vertebrae, but the general technique is this, is to allow us to feel the entire spine as a free-floating system. Okay? Now, once we've done that, we can also move down by opening this up this way. Okay? And what I'm doing here is moving like this. And what will often happen once we've done all of the meridian work is we'll get spontaneous adjustments of the spine as the subluxations just correct themselves by this movement. Now when we move further down, it's better to hold on the rib cage here so that we can again mobilise the spine, the thoracic spine, all the way down. So what I'm doing here, I'm actually checking to see at a deep level that the spine itself has flexibility. To the lumbar. Okay, so now, once we've mobilised the spine, integrated into all the meridian point work that we've already discussed on this course, it's also sometimes useful to use the prone position, especially if we want to get a little bit more penetration. So if you could just go onto your front shapiro. Okay, now in this technique we use the elbows to take the place of the thumbs. This part of the elbow is the same size and shape as the thumb. So what we do is we find the Masnaga bladder meridian, place our elbow right on our fingernail and move our fingers away. And what that does is it ensures that we're right into that groove. Okay? The most common error is to have it out too far. Okay? Once we've done that, we ensure that we're going in perpendicularly and we just bring the body weight in and slowly work down the spine. Okay, and that was a spontaneous adjustment there in the upper thoracic. I don't know if you heard that.
Yep.
And that commonly occurs. This type of work is only done once all the meridian work has been completed. Okay, and we should be able to get down to the lower thoracic spine using this technique. Okay, so once there's been any necessary adjustments, remobilisation of the entire spine, we can then finish off the whole treatment by a traction technique which just helps decompress any remaining areas of compression anywhere in the whole spine. Okay, so should we just demonstrate that? Just go like to turn over. Okay, so now we've done all that work on mobilisation, it's time to finish off with a nice stretch that will just open up the spine and decompress any areas that need to do that. Okay, so the hand position is very, very important. What we need to do is get the heel of our hands right along the base of their cranium here. And the reason for that is we need to distribute the pressure so that it doesn't hurt them or be uncomfortable. Okay, we get both hands underneath like this. Okay, and then what we can do then is we can literally scan through the whole spine, so we get an idea of how the spine's feeling. And then Shakura, if you just like to take a deep breath in, and I would like to breathe the chi right along your spine. That's great. Okay, hold it for a second. Okay, we're going to tune into your spine. Okay, we're both tuning in and then breathing out and releasing. I'm just applying a little bit of traction. Can you see that? It's just, there we are, look, you see?
Yep.
Yeah, the traction's just causing the spine to expand. Okay, and then we just hold it there for a minute, and then we'd repeat that 3 times. Okay, and that's a really good way to finish off work at the back, on the back, and it allows the whole spine just to reorganise itself at the end of the session.